Okay, crash course. So my name is Katherine, like she said. For my honors contract, I wanted to focus on Alzheimer's disease because I looked at chronic traumatic encephalopathy last semester, and I saw that there are some correlations between that and Alzheimer's disease, which is what I'm developing my thesis into. So when I started looking at what Alzheimer's disease really is, I realized it's way more complicated than I could ever explain. But it is considered the 6th leading cause of death in Americans. And I thought it was pretty morbid. I read a fact that said every 66 seconds someone is diagnosed with Alzheimer's disease.
Oh dear.
Yeah, doesn't that make you feel good? African Americans and Hispanics are more likely to develop the disease. And then in 2017, actually, I read something that said Alzheimer's disease and other dementias have cost Americans $259 billion, and it could rise to $1.1 trillion in 2050. And then there is more than 15 million Americans that are unpaid. They provide unpaid care for people with Alzheimer's disease. Another fact that I didn't put on there is that since 2000, heart disease deaths decreased by 14%, but deaths from Alzheimer's disease have increased by 89%.
So it's better to just die of a heart attack early.
Basically, yeah. I mean, the older you get, the more likely you are to progressively die, which kind of sucks. So this is a cross-section of the brain I thought was pretty interesting to look at because it shows you the hippocampus here. In the normal brain, it should look like this, but in progressed Alzheimer's, it's shrunk a lot. And then you also see it within the sulcus and the gyrus. And then your ventricles get a lot wider. They fill up with more cerebrospinal fluid.
So all that is because the rest of your brain is dying and just deteriorating, so that everything else fills up with fluid.
Yeah, so the smaller it gets, basically, the more your judgment declines. You have emotional outbursts, obviously you can't remember, and then language also decreases. So this is a model I looked at. From what I read, it's not really used that much anymore, but I don't even know how to say it, the Wernicke-Geschwind model?
Yep.
So they tell you about there's 2 different parts to language. The first part is speaking and whatnot, and then the other part is comprehension, which is what Wernicke's area does, is the comprehension, and then Broca's area is for speaking and language. And I just thought this was a good visual for it because it shows you that in this picture you see language over here, but then this one shows you that it's kind of in the temporal area, and then your Broca's area is in the frontal lobe. And so the diagnosis. The big thing with Alzheimer's disease is that it's a decline in functioning from your day-to-day activities. So you see your cognitive abilities are declining, you have impaired executive functioning, behavioral changes. My grandpa actually passed away with Alzheimer's disease, and he would get really agitated and confused a lot. He would start to eat napkins off the kitchen table, and he had no idea that it was something that you don't do. And they have different measures to diagnose it. The one I thought was super interesting was, I don't even have it yet. I talk about the different ways to diagnose it in a little bit, but I thought it was interesting because it's not diagnosed in many people. I think there was a study that said only 1/5 to a half of people are diagnosed with dementia and Alzheimer's disease. And there were 3 reasons they gave. One is stigma, the other is that it's natural to have these changes once you get older, and the other one is that you can't do anything about it once the disease is there. The treatment gap is a lot higher for people in low and middle income countries. And they have just started looking at, something I talked to Dr. Burleson about is that they started looking at biomarkers through cerebrospinal fluid and blood, which is pretty new, I believe. So this one, like I said before, your ventricles start to get a lot larger. You can see what it looks like in a normal brain and then what it looks like in progressed Alzheimer's disease. And then here's another PET scan to show you. Okay. So your neuropsychological testing, they use the mini mental state examination, which they use for a lot of other diseases as well. The one I thought was pretty cool was the clock drawing test, which they also do in other, to diagnose other diseases. And then they have the Alzheimer's disease assessment scale, which is way more comprehensive, and they do this whole checklist of things to check on your memory, language, word recall, being able to name objects, and following commands. So the clock drawing test, they started this thing through MIT, where that's what, you can't really read this, but that's what a healthy person would be able to draw, someone with Alzheimer's and then someone with Parkinson's disease, which is another neurodegenerative disease. So what they did at MIT is they figured out how to make this digital pen where they can, I mean, it does the same thing as the clock drawing test does, but it also measures hesitations, uneven lines, and other behaviors that you can't really see when they're doing the test. So it allowed the physicians to analyze think times, which I thought was pretty cool. So the think time is really the time they spent thinking about how to draw the clock as opposed to actually drawing it. And it's supposed to show explicit behaviors.
You know, I don't think those other ones really look all that bad, except for the one on the bottom right.
Yeah.
I know people who couldn't draw a clock any better than the ones in the middle, and I don't think there's anything wrong with them. So.
Yeah, I mean the one on the right. I mean my clock probably looks like that.
Yeah, exactly. Yeah, it's not that bad.
But I don't know. I'm not a physician yet, so I can't really decide. This is another one of the neuropsychological tests that they do. It's called the Nurse's Observation Scale for Geriatric Patients. It just assesses your daily living, personality changes, and behavioral changes. So I don't know if you guys can read some of it from over there, but it says you're supposed to put, if they do it most of the time, all of the time, often, sometimes, or never. Some of them are follows favorite radio or TV programs, which I don't really understand how that shows impairment. I don't know if you guys would.
I don't know. There's a lot of TV shows on now that I can barely follow.
I know, like I missed a whole season of Grey's Anatomy.
I think they mean being able to understand it. Maybe
yeah.
That's what they mean by follow.
Number 7 is able to control bowels, which, I mean, it's really important, but another part of Alzheimer's disease is that you have these amyloid beta plaques that form in your brain, but they're also occurring in the rest of your body, so most of your other functions start to deteriorate as you get more progressed into the disease. And then there's the functional assessment questionnaire, which kind of assesses the same thing. Except this is scored differently. They score you on a scale of from 0 to 3. Early warning signs. So I think it's important to see the warning signs because the person can get into a big deal of problems if you don't see it right away, because they're not going to tell you something's wrong. But a lot of it's things that you would think are in a super progressed state. But I remember someone telling me that problems with abstract thinking, they can't really, I don't even know how to put it. It's just things that you should be able to do on a day-to-day basis, but you have issues with that, and I think that's how we diagnose most things is when it starts to impair daily functioning, is when we start to see that there's a problem occurring. So some of the warning signs are disorientation, changes in mood or behavior, poor judgment, changes in personality. Like my grandpa was, I didn't know him when he was healthy, but he would definitely have mood swings from being super neutral, relaxed, and then he'd be very angry at us for nothing. We would just be sitting there. So I was able to see some of these, but he was in a much more progressed state at that time. Early diagnosis, so I think it was my first slide, I talked about how it's costing Americans $250 billion or whatever.
Billion.
So it's more cost effective to diagnose early. Beneficial for the person because they're able to slow the progression. You can't stop it as of yet, but you could definitely slow it down. Early treatment, you can use NSAIDs, which are non-steroidal anti-inflammatory, because one of the things that happens to the brain is it starts to get inflamed. And you can also decide about your power of attorney and long-term care. One of the things that slows the changes in your brain is a cholinesterase inhibitor. Acetylcholine is necessary for memory, which is something that we learned in this class, and you see less of it in patients with Alzheimer's disease. So if you take a cholinesterase inhibitor, it allows for more acetylcholine in your brain. So this is a CT scan of a 65-year-old man, I believe. He had cerebral atrophy. So you can see in like the temporal, parietal, and frontal lobes how it's kind of shrunk in as opposed to a normal brain. And also the ventricles are they're not super bad, but they're mildly enlarged is what they said. Okay, biomarkers. So these ones, it's so complicated and I can barely explain it myself. But the amyloid beta plaques are something that is kind of like the hallmark of Alzheimer's disease, is what they talk about all the time. The amyloid beta plaques, which is the amyloid precursor protein, it's not spliced in the proper way that it's supposed to be in patients with Alzheimer's disease. So you get these deposits in your signals between nerve cells. So it doesn't allow for communication to occur between the cells. Another one is presenilin 1. Is that how you say it?
I've never really been sure how you say it. The idea is it's pre-senile. So I guess you could call it pre-senilin, but I'm not really sure.
Okay. So that is important for brain and spinal cord development, and mutations in that protein cause early onset Alzheimer's disease, and there's over 185 mutations. Like, that kind of sucks because you get one of those and you're kind of screwed. And then presenilin 2 is meant for cell growth and maturation, and there's 13 known mutations of that. Another thing that I talked about is that within the amyloid precursor proteins, you also have tau proteins, which are also called neurofibrillary tangles. And those also build up inside your nerve cells and cause lack of communication between the cells. These all occur within your brain as you age, but it happens a lot faster in people with Alzheimer's disease. Some of the risk factors that I read about is family history of dementia, definitely. As you age, people over 65 are more prone to it. Traumatic brain injuries, just because of the damage that's occurring to your brain every time you get a concussion. A lower education reduces or increases your risk of Alzheimer's disease. And I think it's just because you're not using your brain as much. I know that tell you to do puzzles and things like that if you have risk factors for Alzheimer's disease, just because it keeps your brain working. And then if you have at least one APOE4 allele, you have a higher risk for Alzheimer's disease. So on the flip side of that, if you drink wine, it's great for you.
Thank God.
Yeah, that's what I tried explaining to my mom. So the thing about this is it's not all together. These are all separate studies that I read about. But if you have red wine, there's something in it called polyphenols, they help aid against plaques and things like that occur in the brain. And then regular coffee consumption and physical activity definitely help. NSAIDs help at the beginning, but if you already have amyloid beta plaques, it doesn't really do much for you to start taking non-steroidal anti-inflammatories. But if you do take it prior, it does inhibit the gamma secretase, which decreases your amyloid beta 42. Behavioral changes, I talked about these a little bit, but things that you really look for are aggression, incontinence, impairment in executive functioning, poor gait, and inability to comprehend or use words, which you saw that one CT scan, it had shrinkage in the frontal lobe, the parietal lobe, temporal lobe, and that's where all of this stuff occurs. Okay, so brain changes. I talked about this, and it is way oversimplified because it is ridiculously complex, but how do I play this video? So I figured I'd play a video for you guys first.
I would just copy it and paste it into the browser if you can't get it to just run. It should be working
Okay,
because
I
the
think
other
I heard
one
it.
worked.
I think I heard it.
The human brain is a remarkable organ. Complex chemical and electrical processes take place within our brains that let us speak, move, see, remember, feel emotions, and make decisions. Inside a normal, healthy brain, billions of cells, called neurons, constantly communicate with one another. They receive messages from each other as electrical charges travel down the axon to the end of the neuron. The electrical charges release chemical messengers called neurotransmitters. The transmitters move across microscopic gaps or synapses between neurons. They bind to receptor sites on the dendrites of the next neuron. This cellular circuitry enables communication within the brain. Healthy neurotransmission is important for the brain to function well. Alzheimer's disease disrupts this intricate interplay. By compromising the ability of neurons to communicate with one another, the disease over time destroys memory and thinking skills. Scientific research has revealed some of the brain changes that take place in Alzheimer's disease. Abnormal structures called beta amyloid plaques and neurofibrillary tangles are classic biological hallmarks of the disease. Plaques form when specific proteins in the neuron's cell membrane are processed differently. Normally, an enzyme called alpha secretase snips amyloid precursor protein, or APP, releasing a fragment. A second enzyme, gamma secretase, also snips APP in another place. These released fragments are thought to benefit neurons. In Alzheimer's disease, the first cut is made most often by another enzyme, beta secretase. That, combined with the cut made by gamma secretase, results in the release of short fragments of APP called beta amyloid. When these fragments clump together, they become toxic and interfere with the function of neurons. As more fragments are added, these oligomers increase in size and become insoluble, eventually forming beta-amyloid plaques. Neurofibrillary tangles are made when a protein called tau is modified. In normal brain cells, tau stabilizes structures critical to the cell's internal transport system. Nutrients and other cellular cargo are carried up and down the structures called microtubules to all parts of the neuron. In Alzheimer's disease, abnormal tau separates from the microtubules, causing them to fall apart. Strands of this tau combine to form tangles inside the neuron, disabling the transport system and destroying the cell. Neurons in certain brain regions disconnect from each other and eventually die, causing memory loss. As these processes continue, the brain shrinks and loses function. We now know a great deal about changes that take place in the brain with Alzheimer's disease, but there is still much to learn. What other changes are taking place in the aging brain and its cells? And what influence do other diseases, genetics, and lifestyle factors have on the risk of developing Alzheimer's disease as the brain and body age? Scientific research is helping to unravel the mystery of Alzheimer's and related brain disorders. As we learn more, researchers move ever closer to discovering ways to treat and ultimately prevent this devastating fatal disease.
Okay, so one thing I did want to mention about the reduced risk factors is that, how do you go back to, Dr. Burleson actually sent me an article from Scientific American that talked about all those reduced risk factors I talked about, but putting them all together in one study. And the study actually said that, well, they had a control group which kind of just went through their own regular physical examinations. If something came up, like they had some heart issue, they would advise them to work out, eat better, do things like that. But then in the experimental group, they had people, they still had the regular checkups, but they also told them to eat mostly like a Mediterranean style diet. So mostly, I think they had fish twice a week, fruits, vegetables, things like that. Told them to exercise regularly. I think they started at 2 days a week for 30 minutes each, and then they increased it to like 3 days a week for 40 to an hour. And they tracked them for 2 years. It was from 2009 to 2011. And they found that the intervention group had 83% improvement over the control group in executive function, 150% better score in speed of processing, which is the time required to perform mental tasks, and a 40% performance increase in complex memory tasks. And then it was also interesting that they found that participants with the gene variant of the APOE4, which puts you at higher risk for Alzheimer's disease, received more benefit from the specified changes than others without it. So I thought that was pretty cool that they were able to do a study that included all of the different factors that can help reduce or prevent Alzheimer's disease into one study. And then for treatment, so I know Mavericks talked about stem cells before, so I thought I would include it in here. They said that you could do treatments with stem cells, which increases your acetylcholine levels, which help with memory function. And it also modulates neurogenesis. And then another thing I've talked about is the acetylcholine esterase inhibitors. The enzyme catalyzes the breakdown of acetylcholine, which is super vital for memory. So if you take acetylcholine esterase inhibitors, it can help prevent the breakdown of that protein or enzyme. And then another one, the neprilysin. It's an extracellular enzyme. They tested it through injections in mice. It helps with the direct degradation of alpha-beta that emerged as an important pathway for clearance. So you can't cure Alzheimer's disease yet. I did talk about the polyphenols before. And then resveratrol is something that, it's a natural polyphenol, but it also helps reduce the beta amyloid proteins. And then the AMPK that I talked about there, it helps regulate protein synthesis. That's it. We have 4 minutes.
Anybody have any comments or questions they want to ask? Anybody have any personal experience with Alzheimer's disease? Yeah.
My father's grandfather. I mean, my husband's grandfather died. His grandpa died a year and a half ago from Alzheimer's. And originally, they thought the dementia and the hallucinations were being caused by medications he was on. And then as they decreased them and his symptoms increased, they were like, oh, nope, just kidding, it is Alzheimer's.
Yeah, what sucks is that you can't, I mean, they weren't able to diagnose it before death, before, I don't know if they are yet. It was all through autopsy. But by looking at biomarkers, I think that'd be a really useful tool to use because it'll give people a much better life expectancy if they have Alzheimer's disease, and it gives them a chance to make their own decisions. I mean, if you don't have a power of attorney prior, you're kind of left helpless, unless you have someone that really cares for you and helps you.
Yeah.
So.
It's not the greatest. My mom actually died from it, so I have unfortunate experience with it. And what you said about and this is something I think many people don't really realize, because when we talk about Alzheimer's disease, we do mainly think about the brain, but it's a condition called amyloidosis, where basically this protein that we all have in all of our cells, it's called a beta amyloid precursor protein. It's improperly dealt with in the body when you have this condition. So you showed that, which I thought was a really good graphic depiction of it. And so when I read the autopsy report from my mom, what I learned was that she had this condition through all her body tissues. Like when they do an autopsy, they test tissues in various places. So she had not only amyloidosis in her brain, but she had it in her ovaries, in her liver, in her, I forget some of the other organs, but lungs. So it's not just the brain, it's your whole, all of your organs, your major organ systems are also basically being gradually turned into generic tissue. It's like what used to be a kidney is now just a blob of this kind of protein. So I guess my take-home message for me is we should all give money to Alzheimer's disease research, because the risk of it is so high. We're living much longer now. I think you said on the first slide that it's 1 out of every 10 people who's over 65. And the risk is doubled for every 5 years or something like that.
Yeah.
So that's a pretty good chance that you or somebody that you love is going to get this disease. And we need to figure out a way of stopping it, or at least delaying it, so that you don't get it until you're 85. You know, because 65, I mean, I know it seems really old to you guys, but you know, it's not really that old. I'm getting there, so. Naturally, anytime I can't remember anything, I get completely freaked out because I saw what happened to my mother. So, this class, we could have talked about neurological disorders, and I chose not to, simply because there's so many different things to learn about. But neurological disorders are really very interesting, and of course, also very costly to our society. Not only Alzheimer's, but also Parkinson's disease, which is incredibly common and is also associated with dementia, which many people don't even know, because we think of it as being a motor disease. So there's just a lot of research that we need to do on this and figure out how to deal with it.
My dad's dad had Parkinson's and passed.
Yeah.
With that. So I'm kind of screwed on both sides.
Yeah,
basically.
me too. It's either going to be cancer or Alzheimer's disease for me.
You got a question or comment?
See you guys? No.
Yeah, my grandfather passed away a couple weeks ago they didn't diagnose him with Alzheimer's, but he had dementia. And he had kind of similar symptoms where his organ tissues were deteriorating, his liver was failing, things like that.
Yeah.
But, why wasn't he ever diagnosed with Alzheimer's? In my unprofessional opinion, he seemed to have all this.
Well, until, and you had mentioned this, but up until recently, and possibly even now, there is no definitive diagnosis of it before you die, because the only way they can determine it is to look at the tissue under a microscope, and nobody wants to have their brain biopsied unless they have to. And since there's no treatment, it's not worth doing the brain biopsy or anything like that. So typically they would just wait until you died and then look at your brain and then say, oh yeah, you died from Alzheimer's disease. But now, what she mentioned, the biomarker, the idea there is to try to learn about chemicals or molecules that could be found in blood or urine or something like that, so that you could diagnose it earlier. Then theoretically you could learn more about what's going on in there, and then maybe find ways of stopping it. So if we could diagnose people when they're like 10 years out from death, then we could study them better. So it's kind of a chicken before the egg, situation. So yeah.
Then it's not a nice thing, but promising thing is all the people in that study from Scientific American were predisposed to having Alzheimer's disease at some point. They had the risk factor, but by eating healthy, exercising, just having a healthier lifestyle, they were able to reduce that risk greatly. So.
Yeah, it is kind of shocking to think how much your diet and exercise matters. I think we all tend to not really believe that. And this study, finally, like if you mentioned drinking wine reduces your risk by 50%, drinking coffee reduces it by 31%, but finally someone has done a study where they took all of these things that we know reduce the risk and put them together in a lifestyle change, and they found a really large effect. And so it sort of tells me that yes, it can help prevent Alzheimer's disease, or at least slow it down. But what else is it doing? What are these foods and this lack of activity and all this crap that we do ourselves all the time? What is it doing to us aside from Alzheimer's disease? Alzheimer's disease is only one thing. So it definitely motivated me to drink more wine.
Yeah, I was going to say the take home is drink coffee every morning and drink red wine every night.
It's like, yeah.
What?
Too much allergic.
Well, I don't know.
Well, too much is bad for a different reason. Too much alcohol is bad for a different reason. And so, yeah, it's just eat real food. People, just eat real food. Don't eat these weird things that they're always trying to force off us. What?
Avocados. That's the way to go.
Avocados are good, yeah. That's good.
So he eats every day, that's why.
Good. Yeah, he'll remain brilliant until he drops dead.